I've battled with depression my entire life, and it wasn't until I was an adult that I actually sought treatment for it, which came in the form of antidepressants. And at first, antidepressants worked until they didn't. And you could feel the depression coming on. It's like you can see this dark storm cloud and you try to avoid it, you try to stop it. You think you can stop the storm, but you can't stop the storm, it's coming. With my depression, I would lose interest in everything that I loved. I couldn't read books, I couldn't focus on them. I was going through the motions and not finding joy or sunshine in anything.
If you are suffering from depression, anxiety, or OCD, and medication hasn't provided the results you need, there is another treatment option available.
My passion is treating the patients with the most severe depression, anxiety, and OCD, the ones that don't get better from medications or therapy. When I first started practicing, the only other options we had were hospitalization and electroshock therapy. And then transcranial magnetic stimulation came along, and finally we had another option.
TMS involves reactivating the areas of your brain that are not performing as well as they could be. TMS therapy is a type of brain stimulation that uses brief electromagnetic pulses. These pulses pass through the skull easily and stimulate neurons in underactive regions of the brain. This is an FDA-approved treatment and has had great success in treating drug-resistant depression, anxiety, and OCD. Most people describe TMS as a mild tapping sensation where the device is being applied.
Not only does TMS have the highest success rate of any outpatient treatment, it also has the least side effects, and it has changed our understanding of depression from a serotonin problem to a brain network problem. When Prozac came out and all the drugs like it that basically increased serotonin levels, the prevailing theory of depression was that there was a serotonin deficiency in the brain, and that's why these drugs worked. And that was the dominant theory and understanding of depression for 25 years or so, until there was enough scientific evidence to refute that. And TMS is part of that story because we're seeing that we can actually modify a brain network with TMS and not touch the serotonin, and yet it works. And it turned out to be the greatest advance in the treatment of mental illness in my lifetime.
When I received TMS treatment, I went to the Center for Brain Stimulation. It was a great experience. The people are wonderful. I just had no idea that this is what normal people felt like. The result that I got was life-changing.
The Center for Brain Stimulation is dedicated to helping adults get back to the life they once knew. If you are looking for non-invasive, long-lasting relief from your depression, anxiety, or OCD, the Center for Brain Stimulation is your key to getting your life back.